Hey everyone, welcome to this week's conversation with Dr. Stephen Nedd about the body and how to fix, protect, or maintain it using outside-the-box alternative solutions. If you're a big fan of the pharmaceutical or surgical approach, you are so in the wrong place, because on this podcast, we're not going to be pushing the conventional medicine methods or way of thinking about health. If you're looking for another way to live longer and healthier, join me, Ron Nedd, and my brother Dr. Stephen Nedd for this week's body chat about inflammation. Me? I'm a retired Twin Cities chiropractor currently helping people buy and sell homes in the Tampa Bay and Los Angeles areas. My brother has a thriving chiropractic practice in the Clearwater area of Tampa Bay, Florida. In this podcast, we're going to chat about all sorts of topics related to health, nutrition, exercise, just about everything having to do with the body. You're invited to listen into our body chat, but don't forget that neither of us is giving you health advice, so don't rush off to do something without either checking with your doctor first or seeing Dr. Stephen Nedd as a patient at his office. Good evening, Steve.
Good evening, Superhost.
Thank you.
Do you remember who that was from our childhood?
Superhost, no.
Saturday afternoon on Channel 43. So when you weren't taking me to matinees to see movies, we'd watch Saturday afternoon Superhost Soups on, and they would show like Three Stooges episodes, and then they would show monster movies like old
Bela Lugosi, like that.
Yeah, exactly.
Mm-hmm. Yeah. Okay, good. So Superhost, and here we are in the evening of the Oscars, and neither of us are watching it. It's because we're dedicated to bringing people information about things like inflammation, which is this week's topic. So why don't you start out with just a really good, simple explanation as to what inflammation is?
Okay, so I've made it real simple, and it's just simply a physical condition in which part of the body becomes reddened, swollen, hot, and often painful, especially as a reaction to an injury or an infection. If it's recent or short-term, like a few hours to a few days, then it's called acute inflammation. And if it persists for an extended period of time, more than 2 weeks, then it's classified as chronic inflammation.
Okay, and that can happen. I mean, most people are used to something like inflammation on the skin or something they can see like that, but it can happen in a lot of different areas of the body.
Yeah. And the type of things that I described, the redness, swelling, and so forth, is due to substances that your white blood cells produce during this process.
Okay.
It's basically a vital part of the body's immune response. It's the body's attempt to heal itself after an injury or defend itself against a foreign invader like a virus or a bacteria and repair damaged tissue. So without inflammation, wounds would fester and infections would become deadly. So just like cholesterol, it's not completely evil, as it is also necessary for normal body function too.
Okay.
Yeah.
That's really good to know.
Mm-hmm.
Now, what kinds of conditions can result from inflammation?
Well, believe it or not, a very high percentage of chronic diseases can result from inflammation, including heart disease, cancer, diabetes, strokes, asthma, psoriasis, depression, bone loss disorders, and inflammatory bowel disease, which includes Crohn's and ulcerative colitis, and emphysema and chronic bronchitis. So anything that ends in itis is caused by inflammation because the suffix itis means inflammation.
Mm-hmm.
So this includes rheumatoid or osteoarthritis, bursitis, which is you have these little fluid-filled sacs that are near parts of your body like your hip where it's a bony prominence. So it's there to protect that, and that can get inflamed. Tendinitis, which is the muscle attachment to your bone, that can get inflamed. Probably heard of periodontitis, which is chronic inflammation of your gums caused by bacteria accumulation.
Mm-hmm.
Sinusitis, tonsillitis, appendicitis, hepatitis, and pancreatitis.
Okay.
Yeah.
Good. So then you've got all these various different conditions. Now, what are the most common ways that inflammation in the body actually occurs?
Well, as I mentioned earlier, it's most commonly comes about from the body's immune response to an infection or repairing an injury, but it can also result from allergies.
Okay.
But what's also becoming more and more common is it resulting from autoimmune responses in the body.
Mm-hmm.
So what this means is that the body actually attacks itself, its own tissues.
Okay.
And it mistakenly responds as if normal tissues are infected or somehow are abnormal. So it's pretty confusing and hard to understand at times when these things occur.
Right.
And now there's at least 80 autoimmune diseases, and the classic sign for all of them is inflammation.
Interesting. Okay.
Yeah. So some of the most common ones are diabetes, rheumatoid arthritis, lupus, multiple sclerosis, psoriasis, various thyroid diseases, and inflammatory bowel disease. And research now shows that up to 20% of the population has an autoimmune disorder, and 75% of them are women. Yeah. There was a study done in 2015 which looked at 30 previous studies over a 30-year period between 1985 and 2015. And it showed conclusively that autoimmune diseases have increased significantly worldwide over that time. And their conclusion as to why this has occurred was that it was mainly due to environmental factors as opposed to genetic factors.
Okay.
So my personal belief is that these environmental factors that they allude to are a combination of increased toxins in our soil, like pesticides and insecticides.
Mm-hmm.
Our water supply having fluoride, chlorine, and hundreds of other chemicals. Our air that has various pollutants and possibly, chemtrails occurring.
Mm-hmm.
Our vaccines, which have mercury, aluminum, and antifreeze, we talked about in our last episode.
That's right.
Cigarettes, which have over 1,100 toxins in them. And especially our food, which includes artificial sweeteners, hormones, genetically modified organisms, pesticides and insecticides, nitrites and nitrates, and aluminum.
Okay.
When these toxins get into our bodies and end up in various tissues, our immune system gets confused, not knowing what they are, and targets them like they're invading viruses or bacteria, and then we end up with an autoimmune disorder. And so, our mom had a less common autoimmune disease called scleroderma,
right,
which was characterized by thickening and tightening of her skin, and inflammation and scarring of many body parts, leading to problems in her lungs, kidneys, heart, and her digestive system, especially the esophagus, due to acid reflux.
The esophagus, for people who don't know, is the tube that food goes from the mouth into the stomach.
Yeah. And her blood vessels were really hit hard by inflammation, causing them to become narrowed, resulting in cold hands and feet due to poor circulation.
Mm-hmm.
Yeah. So, she was a hairdresser and she was exposed to various chemicals on a daily basis for years without proper ventilation. And I don't believe that she used protective gloves or masks earlier on in her career.
No.
That wasn't really a common practice. So she was exposed to a lot of chemicals.
That's correct. Well, that's an exhaustive list of various different ways that can come about, which is good to know. Mm-hmm. So what dietary factors should be avoided completely to reduce the chance of inflammation? What is it that people need to stay away from?
Well, number one on the list is grains and grain products, largely because of gluten and other things that are in there. And that would include breads, pasta, cereal, pretzels, crackers, basically any product that's made with grains or flours. And that can include desserts, unfortunately, too.
Mm-hmm.
Anything with partially hydrogenated oils or trans fatty acids, that would be margarine, deep fried foods like French fries, and most packaged foods. Okay. Our favorite burger joint is In-N-Out. Unfortunately, their oil that they use there, which they change on a regular basis, they claim not to be trans fatty acids.
Good.
Seed and legume oils. These are inaccurately called vegetable oils. And so that includes corn oil, safflower oil, sunflower oil, cottonseed oil, peanut oil, soybean oil, and foods made with these oils, such as mayonnaise, tartar sauce, margarine, salad dressings, and many packaged foods.
Mm-hmm.
Problem with these oils and foods is they contain extremely high levels of inflammatory omega-6 fatty acids as opposed to anti-inflammatory omega-3 fatty acids.
Good to know. And we are going to be doing an upcoming episode on the 2 omegas. All right. So the oils, and what about canola oil?
It is bad news.
That would be another one of those things that would be good for people to avoid.
Absolutely.
Okay.
So some more things include soft drinks and sugar and artificial sweeteners.
Mm-hmm.
So we've already covered 2 out of the 3, and we've got soft drinks coming up in an upcoming episode.
That's correct.
Yeah. Now, here's an interesting one. Dairy and soy, when consumed as staples, meaning eating them every day, tons of.
Okay.
So as long as you're not eating them every day, and as long as the soy is organic, then it's okay, because 90% of the soy in the United States is GMO now.
Right.
Yeah. Now, another interesting one is meat and eggs. If they come from grain-fed animals. If they're grass-fed, it's totally okay.
Okay.
Yeah. Another interesting thing I found out was processed meats that include bacon, hot dogs, bologna, sausage, and jerky. And there's two reasons for that. One is they contain what are called AGEs, which are inflammatory compounds produced during the processing. And they also contain preservatives, colorings, and artificial flavorings that also register as foreign attackers to our immune system, which increases inflammation and the potential for autoimmune responses. Again, it creates confusion, and they attack them like they're a virus or a bacteria.
Mm-hmm.
And finally, artificial additives. So again, read the labels. Artificial colors are documented to cause inflammation. And additives that are used to thicken foods can disrupt the bacterial makeup of our gut, leading to inflammation and weight gain, which has been proven in animal studies.
So now we've looked at what things people should avoid. So what are the foods that can safely be eaten by somebody that has inflammation?
Well, the good news is that this list is longer than the avoid list.
That's good.
Yeah. So let's start with the most logical thing, and that's fruits and vegetables. Obviously, you should eat them raw or lightly cooked, and preferably organic and non-GMO.
Mm-hmm.
Red and sweet potatoes are okay, especially when you eat them with eggs, fish, meat, or fowl, some type of protein.
Okay. All right.
Fresh fish is okay, but avoid farm-raised tilapia, catfish, bassa, which is an imported catfish, and bronzino, which is a European bass, sea bass, because they have elevated levels of omega-6 fatty acids in them, which cause inflammation. Yeah. So meat, chicken, eggs from grass-fed animals is okay. And I can recommend a really good website that lists producers of grass-fed animals, and that's eatwild.com.
Okay.
In the meantime, do the best that you can to get lean cuts of regular meat. Wild game is totally fine. Deer, elk, and other animals that feed on vegetation in the wild.
Mm-hmm.
Anti-inflammatory omega-3 eggs are good too, preferably organic and free-range or cage-free.
Okay.
So when you go to the store, there's like 12 different types of eggs to choose from. Mm-hmm. And so I always try to get organic and free range.
Good.
Raw nuts are good, like almonds, cashews, walnuts, hazelnuts, pistachios, Brazil nuts, and macadamia nuts.
Mm-hmm.
And some really great anti-inflammatory spices include ginger, turmeric, garlic, dill, oregano, coriander, fennel, red chili pepper, basil, and rosemary.
Wow, that's good to know.
Yeah, and of course, Himalayan salt, I'd like to add to that too, because of the high mineral content. Yeah. As far as oils and fats, moderate amounts of organic butter, preferably from grass-fed cows, is okay.
Mm-hmm.
GHEE, which is a type of clarified butter.
Okay.
Coconut oil and extra virgin olive oil. And the important thing about this is it's okay to cook with butter and coconut oil because they can handle high temperatures, but don't cook with olive oil because it can change the molecular structure and create free radicals, which can cause inflammation and potentially worse conditions in the body.
So butter and coconut oil are the two main ones. What about avocado oil? Do you know?
That appears to be okay too. It's not real common, but you can get that in a health food store.
Good. Okay, so butter, avocado oil, and coconut oil are the best ones to cook with. And extra virgin olive oil can also be used, but not for cooking.
Yeah, I always like, if I steam my vegetables, I pour it on afterwards.
Okay.
As far as salad dressing, a really good example of making your own would be using extra virgin olive oil, balsamic vinegar, or lemon juice. And you can even add a little mustard along with spices. I think you've done that before.
Yeah, my everyday dinner salad is half a lemon, some salt, and some extra virgin olive oil. And once in a while, I'll splash in a little bit of balsamic vinegar.
There you go. And finally, let's talk beverages. So top of the list, obviously, is purified water, but organic green tea is really good. And if you choose to drink alcohol, red wine and stout beer are the best choices. And what they found is red wine contains resveratrol and flavonoids, which can be anti-inflammatory. And stout beer has probiotics, which may also have anti-inflammatory effects.
Interesting.
Yeah. So obviously you want to drink them in moderation because too much alcohol actually has the opposite effect, since the process of breaking down the alcohol produces byproducts that are toxic that can damage your liver cells and promote inflammation.
Interesting. Okay. So
Yeah.
once in a while, it's not too bad.
Yeah.
Very good. So that gives us the good list as opposed to the bad list. So that's helpful to people.
Mm-hmm.
Do you think you would have time to put the list together so that we can put it maybe as an attachment that people can get through the podcast link?
Yeah, I'm going to get to that in a little bit.
Oh, cool.
Yeah.
All right. So then what other factors cause inflammation that are under somebody's control that they can do something about?
Well, it's important that you relax and rest more.
Okay.
And so obviously getting your 7 to 8 hours of sleep every night is important.
Mm-hmm.
And then handle stress better. Chronic stress causes you to produce more of the hormone cortisol, which is inflammation's best friend. And so the way to combat that is to take walks, do things like yoga, use less technology and watch less news, and take a much needed vacation when you can. Another thing that I found that was really great and is so simple and obvious is brush and floss your teeth regularly. Brushing and flossing your teeth at least once daily are two of the simplest, quickest ways to fight harmful inflammation. Periodontal disease prevents that. And ideally, you want to brush at least twice a day.
Okay.
So the inflammation related to periodontal disease has been linked to chronic inflammation as well as heart disease and Alzheimer's.
Wow.
Yeah, so visiting your dentist at least twice a year and preferably 3 to 4 times a year is recommended.
Never would have thought that there was that kind of a connection, but that's good to know.
Yeah. Next up would be get off your butt and exercise, but don't overdo it.
Why?
Well, first of all, regular exercises reduces inflammation very effectively by improving your circulation, your lymph flow, and it helps reduce body fat. So what I would recommend is set a goal to try to work out at least 30 minutes a day and try to shoot for 5 days a week and work up to it bit by bit. Some people, they can only do maybe a couple days, but try to set that as your goal to go 5 days. And here's the thing, strenuous exercise can cause injuries to your muscles or joints and lead to acute inflammation. So you can prevent some exercise-induced injuries by avoiding overexertion and by ensuring that you use proper technique during your workout. So I actually recommend that you start with a personal trainer so that they put you on a program that's ideally suited for you.
That makes sense.
And here's the neat thing about the research on this, that it indicates that high-intensity exercise sessions, and what that means is greater than 70% of your maximal effort. Okay? When they last longer than 20 to 30 minutes, or when you do low-intensity exercise programs, which are less than 50 to 70% of maximal effort, when those last longer than 75 minutes, then that can flood your body with stress and inflammation. Yeah. So again, you want to work with somebody that most trainers today know these facts, and they'll put you on a tailored program. What I personally recommend is what's called interval training.
Okay.
And what that is you simply alternate short bursts of intense activity, let's say 30 seconds, with longer intervals of less intense activity, like 3 to 4 minutes.
Okay.
So a really good example of that, would be like a run jog. I used to do this. I would go for like a 5K run, and I would warm up for about 3 to 4 minutes and with a pretty good jog. And then I would pick up the speed for about 30 seconds and I would really move. And then I'd go back down to the jog speed for another 3-4 minutes. And so you can do this running, jogging, you can do it on a treadmill, you can do it on a bike, or you can even swim and do that. And what's cool about this approach is it's been found to increase your fitness as well as burn 50% more calories in about half the time than the typical steady state cardio training.
Interesting.
Yeah, I mean, it follows the old expression, work smarter, not harder.
Yeah, I think that's great.
Yeah. Okay, and then the final thing that's under your control that you can do is reduce toxins in your food, home, and personal care products. And so basically you want to cut down your exposure by eating organic foods whenever possible and choose non-toxic personal care and cleaning products. Amazing website, this group called the Environmental Working Group. And you can get that at ewg.com, or you can, even better, download their app on your smartphone because you want to have this information when you're out shopping. They have excellent resources and references. including this one that's called the Skin Deep Database, which is a list of approved non-toxic cosmetics for skincare like cream and stuff like that, or for your hair like shampoos and things for your nails. Really awesome. They have another thing that goes over tips on household cleaning products. So they go over non-toxic cleaning products that you can buy that they've approved of. Yeah. And they even have a national tap water database to see how safe your drinking water is, plus a water filter buying guide that you can look through.
That's great.
Yeah. And my favorite is the Clean 15 Dirty Dozen charts.
Oh, I've seen that one.
Yeah. So the Clean 15 is non-organic produce that's been tested and found to have the least amount of pesticides. And the Dirty Dozen are non-organic produce also that's found to have the highest pesticide content. So again, that's another nice thing to have, like if you're shopping at not at a like Whole Foods or something like that. Yeah.
Excellent. And what does EWG stand for again?
The Environmental Working Group.
Okay. I want to get these links and put them in the podcast notes. So we'll make sure to do that, and possibly even a link for the smartphone app.
Yes.
And I also made a note that we're going to do a future episode on non-toxic personal care products and cleaning products, because I think that's something we can dive into a little bit more in a future episode.
Okay, sounds good.
Now, what is the connection between inflammation and depression? You listed that as one of the conditions that can come about, but how are they connected?
Well, there's more and more research coming out now that depression is due to more than just altered levels of serotonin in the brain.
Right.
And just last year in Great Britain, they found that there's a link to inflammation and depression after determining that it is a physical illness caused by a faulty, overactive immune system. Yeah. So what they found is that the depression can result from the immune system's failure to switch off after a trauma or an illness exposure. And this is similar to the low mood that people often experience when they're fighting a virus like the flu.
Right. That's something that's real to most people.
And they also found that 30% of people suffering from inflammatory diseases like rheumatoid arthritis are depressed. And that's more than 4 times higher than the normal population.
Wow.
Yeah. And then a large number of recent papers and with unexpected results from clinical trials have shown that treating inflammation seems to alleviate depression too.
Wow.
Yeah. So I learned about the gut-brain connection about 20 years ago while I was attending nutrition and functional medicine seminars by Dr. Jeffrey Bland, who's also known as the father of functional medicine. And I was astounded to find out that your gut, which is, your stomach and intestines, is literally your second brain, because it's created from the identical tissue as your brain during fetal development. Yeah. And it contains larger amounts of the neurotransmitter serotonin, which is associated with mood control. The other thing that's cool is there's an increasing number of clinical studies that have shown that treating gastrointestinal inflammation with probiotics, vitamin B, vitamin D, and omega-3 fatty acids may also improve depression symptoms and quality of life by reducing the pro-inflammatory triggers that go to your brain from your gut. So the other thing I'd like to add about gut inflammation is that it can lead to a condition called leaky gut syndrome.
Right.
And this is when the gut lining becomes compromised, allowing undigested food particles to escape to the bloodstream, which creates major problems, especially with the immune cells, that they get confused. And since they have no idea what these food particles are, they assume they're foreign invaders like viruses and bacteria, and they treat them as such and create an immune response along with inflammation. And so, again, this will create allergic symptoms since your body's attacking food instead of a virus or bacteria, which is the normal response. And it can also cause, of course, autoimmune conditions too.
Wow.
Yeah. I remember when I tested our mom for food allergies. I used this lab, and I think there was about 120 different things that she tested for. And out of 120, she was sensitive to 101.
Wow.
Yeah. And I found out she had a leaky gut. I treated her for that. And after a few months, I tested her again, and she was only sensitive to 30 of those.
That's great.
Yeah.
So if somebody has reactions to various different foods, it could be coming from a leaky gut syndrome situation.
Yeah. Because your body doesn't have a chance to fully digest and break the food down into its basic particles. And so this big bolus of food seeps through, gets into your bloodstream, and your cells look at it and go, what the hell is that? I've never seen that before. It must be a virus or something.
Mm.
Yeah.
Well, that's good to know. We may go into a little bit more on the intestinal tract in a future episode and cover leaky gut and other things.
Yeah.
Now, what can somebody do diet-wise to help with inflammation or even to prevent it?
All right. So this is kind of an answer to the previous question you asked me about reference for the foods that are good and bad.
Yeah.
Yeah. So there's a number of books out there on anti-inflammatory diets, but instead of going through the trouble of reading a whole book, I recommend the Nutrition Foundation booklet from Anabolic Labs, which you can access at anabolic.com. So make sure you include a link for that.
Okay.
Not only does it list the anti-inflammatory foods as well as pro-inflammatory foods that we went over earlier, but it also includes healthy meal suggestions for breakfast, lunch, and dinner, as well as snacks and desserts. It does a nice job of dedicating an entire page to why grains are a major cause of inflammation too.
Excellent. So in addition to that, are there any dietary supplements that are good for handling inflammation?
Oh, absolutely.
Okay.
So number one on the list is omega-3 oils. And my favorite is fish oil, in particular, Carlson Labs, the very finest fish oil.
And I have to comment because you talked about that when we dealt with cholesterol. And I ordered some and I've been using it, and it doesn't taste like fish oil.
Yeah, it's won awards for taste, and you can get it with either lemon or orange.
Yeah, I got the orange kind, and it really doesn't taste like fish oil. I don't mind the taste of fish oil, but it's nice that you don't have, I take a tablespoon of it each day and just take it right down from the spoon. And it isn't unappealing in any way.
Yeah, and for those of you who have a hard time with it, it blends nicely into a morning protein smoothie, and I actually have a really good recipe for that, so maybe we'll include that too.
Great. All right, so there's the omega-3s, that's one thing.
Yeah, and for those who are vegetarians, they can also get their omega-3s from either ground flaxseed or flaxseed oil. And so what I like to do sometimes, just to mix things up, is I'll go next door to Nature's Food Patch, and they have in their barrels, they have, you can buy this stuff in bulk, and I'll get a bag full of that and I'll add it to my protein smoothie too.
Excellent.
Yeah. Okay. So next up would be turmeric, and the active ingredient of that is called curcumin. And this is the most popular anti-inflammatory supplement sold now. And it works. Yeah.
Okay.
Enzymes on an empty stomach. For example, Wobenzym is a great brand for that. That's been found to work for many years. Resveratrol, which is found in red wine, grapes, and chocolate. There's some evidence that shows it's a more potent anti-inflammatory agent than over-the-counter anti-inflammatory drugs like aspirin and ibuprofen. And if you potentially have leaky gut syndrome, then the NutriWest supplement called Total Leaky Gut is excellent for that.
That's good to know.
Yeah. Otherwise, you can only get that from a health professional. So otherwise, if you need to treat that right away, you can go out and buy some whole leaf aloe. You get it in a juice. You can drink that. And then also L-glutamine. Those are the top of the list for leaky gut syndrome.
Okay.
Yeah. Ginger and rosemary also have excellent anti-inflammatory properties. I know that sounds like something you'd find on Gilligan's Island.
I know.
Yeah, except, Ginger Marianne, sorry. That's kind of close, though.
Okay.
I know I beat you to it this time, sorry. And then small amounts of dark chocolate have been shown to reduce systemic inflammation and boost heart health, probably because it contains resveratrol and magnesium.
All right, that sounds great. Now, are you going to be able to put together a list of these various things like we did in the other episode where you'd gone over quite a few recommendations?
I think so.
Excellent. Now, if somebody has symptoms that seem to be coming from inflammation, how can they find out if that's what it is? And are there any tests that are really good for doing something like that to find out if the symptoms they have are inflammatory symptoms?
Yeah, going back to the Anabolic Labs Nutrition Foundation booklet, it includes a personal assessment that you can take, which is an inflammation checklist that looks at all the signs and symptoms as well as dietary factors associated with inflammation. And the more you check off, the more likely it is that you're suffering from inflammation in the body.
Excellent. So that's something that anybody could do.
Absolutely, yeah. It's free. You can just go online to the site and we'll have a link for that.
Excellent.
Yeah. There's 2 excellent blood tests for inflammation that run around $15 to $20 per test. And I referenced this back in the episode on cholesterol.
Okay.
Episode 6. That is C-reactive protein, which is especially a good indicator of acute inflammation. So elevated levels of this means there's active inflammation in the body.
Okay.
And then there's ESR, also known as SED rate, and this could also mean inflammation, but it's less specific, as it could also be high with other conditions like anemia, pregnancy, and aging.
Okay. All right, so those would be the 3 things then, is the anabolic labs self-test questionnaire, and then the ESR and
C-reactive protein.
Good. So now, is there anything else you'd like to say on this before we end?
Well, I think that pretty much nails it. I mean, this is not a topic to take lightly since it's associated with most chronic diseases, as well as 9 of the top 10 causes of death in the United States, including the top 3. Heart disease, cancer, and chronic lower respiratory diseases. So I recommend that you share this information with others, and the best way, obviously, is to have them listen to this podcast as many times as necessary to get all the pertinent information across to them.
Excellent idea. And you can also download the information through links in the podcast notes. So this was an excellent episode, Steve. Thanks for all the research again.
Yeah, I had a great time.
And next week, we're going to be talking about soft drinks, the modern day hemlock. And we'll be live from Los Angeles and Clearwater, Florida. Good night, Steve.
Good night, Ron.
Thanks for joining us this week on the Body Chat Podcast. We both really appreciate your time and your attention. We want to provide you with interesting and informative episodes each week. And if you have a topic you'd like us to cover or any questions you'd like us to answer, send an email to us at info@bodychatpodcast.com. That's info@bodychatpodcast.com. To make sure you don't miss any of our upcoming episodes, subscribe to the Body Chat Podcast now on iTunes, Stitcher, Google Play, or Spotify. See you next week.